So I'm just going to talk to you a little bit today about what we know about autism, how we diagnose it, what we think might be some of the causes for autism, and what some of the treatments are. And I really want to emphasize today what some of the latest research advances are. Vanderbilt is heavily involved in autism research, and it's a very exciting field for me, and I want to share some of that with you. So most of us have met someone with autism. Just by show of hands, how many of you know someone with an autism spectrum disorder diagnosis? Yeah, almost everyone, which is just amazing. When I first started in this field, autism was considered a rare disorder. And it was one of those kind of taboo subjects almost that people were afraid to kind of talk about. And now we know autism is actually a very prevalent kind of condition. How about if you would turn to the person next to you, tell them one thing that you've heard about autism. Doesn't necessarily, you don't have to know if it's true or not. Tell them one thing that you've heard about autism as a disorder. Okay, that's great. It sounds like you guys have heard a lot of different things. So would anybody be brave enough to volunteer to me one thing that they have heard about autism? Yes?
It's a broad spectrum of syndromes from extremely mild to extremely severe, and maybe caused by different things.
Great, yeah. So I'm going to repeat it for you. He said it's a broad spectrum of disorders from very mild to very severe, and it may have multiple different causes. Okay? Yeah?
Happens most often in boys.
That's right. The prevalence rate is higher in boys than in girls. That's true. Uh-huh.
So you are incapable of interacting with others in the social way.
You know, you can check your Vanderbilt email through the web, right?
Okay.
So I'm going to bring up a web browser.
Okay.
Did you email it to yourself?
I was trying to. I can't get a connection. Yeah, I can't get a connection over here. So, yes, people with autism have difficulty with social interaction. That is correct. So, yeah.
Is that true? I know someone with autism and he interacts and, is that?
Right. So when we're talking about the fact that it's a spectrum of disorders, that's a good point. And I think that's a common misconception that people with autism aren't interested in social interaction. And while there are some children with autism who avoid social interaction, there are many children and people with autism who seek out social interaction, but it's in how they go about those interactions that may be slightly unusual or awkward, or they may have trouble sustaining the relationships, keeping the back and forth and the conversations going, knowing how to join a group, picking up on cues when it's time to stop the conversation, those kinds of things. Exactly. Uh-huh. That is true. The research has been pretty definitive on that autism is not caused by vaccinations. And although it's still a controversy, I guess, within the community, within the research field and the scientific community, that's been a resolved issue. In fact, some of the early research that led to those concerns has been discredited. Mm-hmm.
People with autism often have digestive problems.
This is actually true. So that people with autism often have digestive problems. So that's something that we found frequently reported by families, and so we've decided to do some additional research on that. And actually, some of that research has been going on at Vanderbilt. They found some genes that make people more at risk for having gastrointestinal difficulties, and there's a subset of people with autism who have that difference in their genes. more likely to have constipation, diarrhea, those kinds of things, over and above dietary types of issues. Anybody else? Uh-huh.
Asperger's is a form of autism.
That is true. But there's some interesting developments in that case. So traditionally, there have been more than one different type of way that we've characterized people with autism. We talked about autism, Asperger's disorder, pervasive developmental disorder, not otherwise specified, Brett's disorder, and childhood integrative disorder. And some research, part of which was done at Vanderbilt, suggested that those categories weren't holding up very well. So what they found was that when you trained psychologists to do really thorough, really reliable evaluations of children with autism, we were pretty good about calling it autism or not autism. With all the other sites across the country, we matched up pretty well. Where we didn't match up with was what we called it. So some people called it Asperger's, some people called it PDD and OS, some people called it autism. And what made the difference was nothing about the child, it was where they were diagnosed. So if they were diagnosed at one site, everybody was called autistic. And if they were diagnosed at another site, a higher proportion might have been called Asperger's. So it really seemed to be more about the beliefs of the clinician about what those different disorders meant than anything real about the child. So recently, just in May, we've released a new kind of diagnostic criteria that we hope is going to be more accurate. So everything is now called an autism spectrum disorder. And then we specify the level of support that people need, what level of language difficulties they're having, what level of cognitive difficulties they're having. But rather than having all those discrete categories, everything is called an autism spectrum disorder, which seems to be perhaps more accurate. That, as the gentleman mentioned earlier, this is really a spectrum of disorders where people have really wide variety in the level of functioning that they have. But there are some core deficits that seem to kind of appear in people with autism kind of regardless of other things. So some of those things, let me go through those. Okay. It's okay. I think it may be better if I just talk than try to fool around with it. Yeah. Okay. So some of the things that we always see in autism are deficits in social communication. So I think one of the kind of myths that's out there often is that people with autism always have trouble with speech. They don't talk, very limited speech. And that's not always the case. While there are some people with autism who have very significantly impaired speech, that's not really predictive of whether a person has autism or not. It's really more about how they handle the social aspects of communication. So can you think of any pieces in communication? How do you communicate over and above just the words that you say? Uh-huh. Right. So eye contact is a huge part of how we regulate our social interactions. So it lets someone know that we're interested. It lets them know when we're no longer interested. We use our eye contact to direct our attention to certain things in the room. And so if a child is not kind of zeroing in on another person's eye contact, they're missing a lot of information. They're missing all of these cues. They're missing the facial expressions. They're not, so if I said, hey, look at that, and pointed, and they're not following my eye gaze, and I start talking about this thing over here, and their attention is over here, they're missing an opportunity for learning. And so, yes, eye contact is very important. Mm-hmm.
If 85% of all communication is nonverbal, they don't understand it. And aren't they more used to details and the minutiae? For instance, coding computers and specializing in absolute minutia.
Yeah, so that's probably not the case for every child with autism, but we do see people with autism be sometimes very good at remembering details. So particularly if it's something that they're very interested in, they may memorize lots of facts and details about those kinds of things. And you're right. So if 85% of communication is nonverbal and you're not picking up or using nonverbal communication, then you're missing a lot of that.
Your volume is down. Your volume went way down.
On my microphones, let's see. Right. Just the, okay, this one. Yeah. I will try to talk louder. But that's a good point about volume. Volume is another one of those things that people with autism sometimes have trouble with modulating their voice. So talking too loud, talking too softly, not using the right inflection, overemphasizing certain aspects of syllables and words, which can all impact their intelligibility. So social communication is problems with that back and forth in social interaction, being able to sustain an interaction, initiate it, then know how to respond, listen to the person, how they respond, and then provide an appropriate response back. So that back and forth reciprocity, which starts when they're really young, of just doing playthings back and forth, like rolling a ball back and forth, having social kinds of peekaboo back and forth, that kind of building those reciprocal interactions, nonverbal communications, and then problems developing and maintaining relationships. The other important aspect of autism spectrum disorders is what we call repetitive behaviors and restricted interest. So this can cover a wide variety of things, but we think about repetitive motor movements. So moving the hands in unusual ways, the fingers in unusual ways, hopping up and down, spinning in circles. So just moving the body in very unusual and repetitive kinds of ways. Also being repetitive in their verbal behavior. So maybe repeating the same words or phrases over and over again. Hearing things on television or things their parents have said and then repeating those phrases, sometimes out of context. Being very stuck on routines, so liking things to go in a certain way, in a certain order, things to happen at a certain time, and it causing some anxiety and upset when things don't go the way that they expect them to go. Like I was talking about earlier, having very restricted, nice. One thing worked today, good. So having restricted fixated interest, and this can just take a really wide variety of things. So it might be trains, it might be baseball stats, it could be very esoteric kinds of things like cats or movie schedules. But whatever it is, they tend to get highly fixated on those things, learned lots and lots of information and details about it, want to talk about those things, and really having trouble understanding why you don't love learning about train schedules as much as they love learning about train schedules. And then also having either being overly sensitive to sensory input or seeking out sensory input. So that could be trying to find things to touch or feel, or being really sensitive to how things feel, like the clothes on their body, having their hair cut. Things like looking at lights, looking at shiny objects, watching things that move and spin, looking at lines and patterns, licking things, putting things in their mouth, putting things to their lips, just kind of really exploring their environment in a more of a sensory kind of way, rather than the way that we typically do. So those are kind of the core deficits of autism that we see across all people with an autism spectrum disorder, although there can be a lot of variety in what that person looks like and how they are functioning. From people who are gifted, who have very high intelligence, to people who have significant cognitive impairments as well. What have you guys heard about the prevalence of autism? 1 in 88 is the most kind of recent, reliable statistics that we have. Those are based out of the CDC, where they did kind of surveillance of 14 different sites looking at records to see if a child had been diagnosed with autism or had the symptoms and characteristics to meet the criteria for a diagnosis of autism. And that has been a 600% rise in prevalence in the past 2 decades. So that's huge. Do you have any idea of why that might be? Yeah.
Probably because so many more are diagnosed today with autism as opposed to those that went undiagnosed.
Yeah, so that is a piece of it, I think, that previously perhaps they lived in communities where they were supported, where those differences were tolerated, and they never kind of reached the level of getting to a place where they could receive a formal diagnosis. Uh-huh.
Could it be environmental factors, environmental influence?
So actually, I'm going to talk a little bit about some research that suggests that could be a possible risk factor for people developing autism. Mm-hmm. Pollution. Could it be something in the environment like pollution? Mm-hmm.
I worked in special ed for a number of years, and the things that you're talking about, historically, we used to see a lot of kids with those same kind of behaviors that were categorized as developmentally challenged.
Right.
And I'm not
Yes.
so sure that a good portion of these kids were either misdiagnosed now or just the spectrum covers that.
Yeah, so I used to work in the school system too, and I found that a lot of children were diagnosed with other types of disorders that now we recognize as part of the autism spectrum. So they might have previously been diagnosed with a developmental delay, with an intellectual disability, with a learning disability, with a health impairment, and now we recognize those things as part of an autism spectrum. And we're diagnosing a lot more children who are on the milder end of the spectrum, and also children who are on the more severe end of the spectrum, where there was a time where we probably were catching more of those, what you think of more classic kind of presentation of autism. Mm-hmm.
I think parents feel more comfortable approaching a professional
Yes.
about it because way back, they used to feel guilty.
Mm-hmm.
Parents, they felt it had to be their fault that
Right.
the child was autistic, especially if it was a first child.
Right, right,
So therefore, they would go to professional help.
right.
because they felt it was their fault.
Right. So she said that parents now are more willing to seek help, that in the past there was more of a stigma where parents felt like this must be their fault. And I think psychology didn't help that by talking about in the past about how it must be something that the mothers were doing that were causing autism, which has been completely disproven at this point. There is a lot more awareness about autism, both among parents, but also among pediatricians. And there are now guidelines for all pediatricians to screen children for developmental delays and autism at their well-child checks at 18 months and 24 months and 36 months. It's kind of part of a standard of care now. And so we're starting to catch children earlier and earlier and earlier. And parents actually are often able to pick up on differences and concerns even in the first year of life. So a lot of our research now has started looking at how early can we detect signs of autism in children. And the reason that we're doing that is because it looks like the research suggests that the best predictor of a good outcome is early identification and early intervention. And so the earlier we can get to children, the more likely they are to have a better outcome right at that point when their brains still have plasticity and we're able to maybe alter the course of development, that it's very important that we catch them early. Mm-hmm.
1 out of 88 incidents, is that United States? Is that
So that's in the United States. Those estimates are based in the United States, and it really varies state to state. So some states, the rates are much higher. Some states, like Alabama, the rates are much lower. So they're not necessarily picking up on as many cases. There was recently a study, though, in South Korea, where they based the estimates not on reviewing records, but actually testing a large group of second graders, and found the incidence to be closer to 1 in 37. So it could be that our estimates are still off a little bit. Mm-hmm.
Is there not research on genes today that now is beginning to
Yeah.
find out?
Right. So I think when geneticists first started thinking about autism, they expected to probably find a few different genes, maybe somewhere between 10 to 50 genes that might be contributing to autism. And what we found is that there's likely thousands and thousands of genes. So there are certain genes that are associated with particular disorders, like Fragile X syndrome, Angelman syndrome, Rett syndrome, that when a child has those conditions, there's a high likelihood that they'll also receive a diagnosis of autism. But when you look at the population of children with autism, that only accounts for a very, very small number of those cases of autism. So what we've started doing is looking more at very small variations in the genetic code. They're called, often called copy number variations. So part of the gene gets deleted, or a duplication occurs, and that puts a child at cumulative risk for autism. All of us have copy number variations in our genes, but it seems that children with autism, this is occurring more frequently, and so this puts them at higher risk. There's a lot of different things that might contribute to that. One of the things that's really changed in our society is how old we are when we're having children. So 50 years ago, it was more common to have your first child early in your 20s. And now we're having children much later. And some research has suggested that both maternal and paternal age can impact risk for autism, but in particular, the father's age can impact the risk for autism. That the older the father is, the more likely he is to have some of these variations in his genetic code, and then those things are passed along to the child. Mm-hmm. Yeah, I think so. I mean, I think he said, would you consider this a paradigm shift in how we view genetics? And I really do think it is, that we've gone from looking for these major differences, major disruptions in the genetic, in our chromosomes, to looking at very small variations that additively create risk. And so there's a lot of research on what we call epigenetics. So thinking about how the environment then interacts with our genetic code to either turn certain functions of the genes on or turn them off. And there's actually some research now, in particular in Fragile X, which, like I said, has a high association with autism, that we might even be able, once we identify those things, to provide a medication that supplements a protein that's been turned off by those genetic differences. So the genetic differences turn off a protein that's important for brain development, and we might be able to supplement with that protein in order to kind of alter the course of development. Mm-hmm.
At the present state of the art, what percentage of the people who are diagnosed
can be improved? At this point, with appropriate treatment, we expect all children to make significant improvement. There is a very small number of kids who, with treatment, will move off the spectrum, so will no longer meet criteria for a diagnosis of autism. We once thought that was impossible, but actually now there's some research that suggests there is a subgroup of children who will no longer have enough severity of their symptoms to meet a diagnosis with treatment. But for most children, we expect improvement. Some of the things that help predict how much improvement we'll see is cognitive level. That's a big predictor of the level of improvement that we'll see. There's a new treatment, and there's clinical trials going on at Vanderbilt right now. It's called the Early Start Denver model. And what it does is identifies children very early who are at risk for autism. It's a very play-based assessment. So children with autism's play is very disrupted, and we know play is kind of the work of a child. So it tries to find ways to engage the child and keep them engaged so that they have more of those back and forth interactions. And by doing that, by working on those specific skills, it's very kind of, even though it's play, it's very kind of planned out and regimented. It's at least 20 hours a week of intensive intervention with one-on-one with a therapist. And we're actually seeing large gains in cognitive skills in those children who receive that early intervention. Mm-hmm.
What is the difference between autism and ADHD?
That's a good question. So what's the difference between autism and ADHD? ADHD is really focused on, it looks like there's understimulation of certain parts of the brain that causes problems with being able to attend for long periods of time, being able to inhibit impulses, problems with what we call executive functioning skills, which are kind of controlled more by your frontal lobes, so being able to plan things out, to anticipate consequences, to shift your thinking, to try alternate plans when something doesn't work. So kids with ADHD have those kinds of difficulties. The thing is, kids with autism also have those kinds of difficulties. And recently, with the changes in diagnosis, you can actually diagnose both autism and ADHD at the same time, which you could not do in the past. But the difference is that children with autism also have these significant problems in their social communication skills and restricted interest repetitive behaviors. Some kids with ADHD will have problems with social interactions, but it's more because they're impulsive and intrusive at times, and so they're not monitoring their behavior, and they might do things that are kind of socially inappropriate or annoying or irritating to other people. But then they can tell you usually what it is they did and what the consequences of those things were, where a child with autism is going to have a lot more difficulty understanding the kind of nuances of social situations. Uh-huh. Yeah. Mm-hmm.
Do the chemicals, the chemotherapy that we use now for autism, do you think it really works?
Yeah.
The drugs that the children put out, do you think it really works?
Yeah, so this was a question about medication for children with autism. And traditionally, the medications that we've had have not been fantastic. They treat more of the symptoms. They don't really treat core deficits in autism. So a lot of the medications that have been used traditionally have been things like Risperdal, which is an antipsychotic medication, and it can help kind of dampen some of the more challenging behaviors and aggression, things like that. But it doesn't really improve their social interaction skills or reduce their repetitive behaviors, which are the core deficits of autism. There is research going on right now across the country and at Vanderbilt looking at more novel medications that may actually target some of the more core deficits of autism. There's some medications that are showing promise in increasing a child's social interest and social interaction. There's going to be a study starting in January looking at oxytocin. Have you guys heard of the hormone oxytocin? So that's what's released when you snuggle with your puppy or you hold your baby or your grandchild. Is that bonding hormone that's released that kind of makes you feel good and makes you feel connected to another person. And it looks like there may be some problems in that hormone system in people with autism. So they're going to try a nasal version of oxytocin to see if we can increase social interaction, social interest in children with autism. So I think we're getting better, and it will continue to get better. Like you said, as we understand more of the genetics and what has gone wrong in development, we're better able to target the medications, but we're not quite there yet. Mm-hmm.
You talked about plasticity.
Uh-huh.
And at what age does this no longer take place?
You know,
Does it always take place?
yeah, it always takes place. We used to think that there came a point where our brains were just kind of static and we were no longer making connections. Research suggests that's not true, that even into adulthood we can still continue to make changes to how our brain connects and works. But there are definitely critical periods for development. So there are times in development where lots of things are happening in the brain. That 18 to 30-month range is a time where the brain is really both making a lot of new connections, but also getting rid of connections that are not necessary. So they call it pruning. So it's kind of like, like with your shrubs. So the parts that you don't need, getting rid of those so that the parts that are still there work better. During that kind of critical period, a lot of those kinds of things are happening, and we think some things are going wrong in the brain and how those connections are being made and how things are being pruned. And there's some research that suggests that there are abnormal connections. How the brain is connected in autism is different than in the typical brain. And so if we can get to them at that very young age, that 18 to 30-month range, during that critical period of brain development, we may be able to have a larger impact than we might be able to when we get them at 7, 8, 9 years of age. That makes sense? Uh-huh. So dyslexia means it gave up on me. It's like, you're never going to get me to work. I'm shutting down. So dyslexia is a reading disability, and definitely children with autism are more likely to have difficulties with reading, but those are definitely two kind of separate conditions, and children with autism don't necessarily have dyslexia, and children with dyslexia don't necessarily have autism. Uh-huh. Yeah.
Is there any possibility that research be done in solving basic problems of the brain,
Right. So if I understand your question correctly, you're wondering if there might be treatments that actually change how the brain functions. And the answer is yes. So the therapy that I was talking about earlier, the Early Start Denver model, I'm sorry. Next time I'll bring my Dell. After they did the treatment with this intensive early play-based intervention, they brought the children back and did what we call ERP. So they put electrodes on the child's head and look at brain activity. And they actually saw differences in children who had received the ESDM therapy versus children who received treatment as usual in the community. And so how they were processing information about faces, there had differences in brain activity that looked more like the way typical children process faces than children with autism, where the children who received the community treatment as usual showed that more typical profile of how children with autism process faces. So it looks like actually behavioral intervention can have an impact on how the brain develops. But then there also are some medications that are kind of in the early stages in the works. As I mentioned with Fragile X, they're starting with that condition, which is a known genetic disorder, and that there are, because of those genetic differences, like I said, there's a protein that's not produced in the brain that needs to be there for brain development. And so they're looking at ways to supplement that protein and try to turn that system back on, which might then alter the course of brain development. And so those trials have started in Fragile X and are gradually moving into autism as well to see if they have a similar impact. Uh-huh.
Are there any tests for fathers, potential fathers and mothers before pregnancy? Is there anything that can be done to see some tests?
Yeah. Yeah, that's a good question. And the answer is no, not at this point. While you can be tested for these other genetic disorders that we know if you have that, you're more likely to have a diagnosis of autism. Because there are so many potential genetic differences, all of these small cumulative differences, you could test for it, but it wouldn't necessarily be meaningful at this point. So it's now standard of care for all children who receive a diagnosis of autism to have thorough genetic testing that looks for all of these potential differences, these copy number variations. But even when we see them, we're starting to do research where we're clustering those groups of kids together, doing testing and seeing what their profile looks like. So if you have this particular deletion or duplication in your genetic material, maybe your profile looks more like this, and if you have a different one, maybe your profile looks more like this. But those studies are still kind of in the early stages, so there's not necessarily a test for that. We do know that if you have one child with autism, the incidence of having a second child with autism is somewhere between 18 and 20%. So that definitely is a higher risk. Uh-huh.
We're talking about children now, since this was a recently diagnosed disease or syndrome. What about the adults? Is this something that children grow out of?
Right.
And you would see they're identified as when they got special opportunities to learn and not necessarily defined as retarded, that children eventually grow out of this?
That's a good question. And so that's really one of the places that our research is turning is to look more at what happens when these children grow up. Because thousands and thousands of people with autism are turning 18 every day. I think it's around 50,000. And so we're starting to look at what does that mean long term? What are the long-term outcomes for people with autism? Like I said, we're starting to learn that there is a very, very small group that may no longer have the diagnosis as an adult, but that's rare. It is more typical for people to receive intervention, to make some progress, but still have lifelong impact of their disorder. Now, because there's a lot of variation in autism, there's also a lot of variation in what that looks like in adults. So there are adults with autism who have jobs, who go to college, who have families, and then there are also people with autism who are not able to, are not employed, who are in assisted living facilities, in group homes, things like that. But what we found is that we definitely need more focus on helping them transition from school into adulthood. that there's a very large, over half the population of people with autism spectrum disorders, 2 years after they leave high school, are at home, no activities, no employment, no post-secondary education, no active involvement kind of in their community life. And that, that has a huge cost, both to the families, to the individual, to us as a community, for them to go from being actively engaged and having intervention in schools to sitting at home and having no activities at all. Uh-huh.
Does nutrition play any part of autism?
So there's been some research that folic acid, which of course is a risk factor for a lot of neurological kinds of conditions, that a mother having appropriate folic acid intake, not just during pregnancy, but actually before pregnancy as well, is important for a protective factor against autism. There has been a lot of kind of talk in the general community about diets and autism. So there are families that put their children on very kind of restricted diets where there's no gluten, no casein. The research would suggest that unless a child actually has a medical condition that causes a sensitivity to those foods, like Crohn's disease or a food allergy, that there's no impact on behavior. Although some families continue to feel like that's helpful, and so they do it, and it's not necessarily harmful as long as your child's getting good nutrition, but there's no research evidence to suggest that that will actually fix the problems of autism by changing the diet. Mm-hmm. Yes. So there's definitely a lot of research using both MRIs, functional MRIs, and what we call diffusion tensor imaging that really looks at the connections within the brain. And that we do find differences both in brain size and structure and the kinds of connections that are formed. Mm-hmm.
It seems to me that the basic problem to start with is whether the child and the mother can bond. And all future social interactions can be shown back to the beginning of bonding between mother and child. Is there anything that can be done to improve that?
Yeah, so it's when we think about attachment, it's about a match often between the parent and the child. And children with autism are not necessarily giving the same cues to their parents. They're not responding in the same way that a child typically would, with those eye contact, those big social smiles, the pointing, gesturing, all of those kinds of things. And so it's not just that their attachment with their mother is impaired, their interactions with people in general are impaired. So oftentimes when I see these children, they actually have what I would describe as a very close bond and attachment with their mothers, and often with their fathers and other family members. But the problem is it's not generalizing to other people. And so a lot of the interventions that we use are not just a therapist coming in and interacting with the child, but it's teaching the parent a different way to interact. So if the child with autism, when the parent tries to engage them in play, the child walks away or looks away or doesn't show interest, then what does the parent do? How do they respond? Do they, over time, give up and stop trying those kinds of things, or do they get more intense trying to force the interaction? And so a lot of the therapies focus on parent training, so teaching the parent that what worked with your other child is not necessarily going to work with this child. And so there's got to be different ways that you interact with them and sustain the interactions to try to help them learn those skills.
As usual, I find myself in the position of absolutely infuriating at least the next 79 people who want to ask me questions. But our time, unfortunately, is up. There'll be a 10-minute break.
Thank you.